over to Sarah, who's going to kick us off.
Thanks, Alex. It's really nice to be with all of you today. My name is Sarah Babcock, and I recently joined Jefferson Parish as one of the new CAAs overseeing public health initiatives. So this is a new position within Jefferson Parish. President Lee Shang really felt in the midst of the COVID-19 pandemic, that they really needed someone who understood public health, understood how to respond to a pandemic, but also someone who could address all of the health disparities that the world or our country is realizing right now. So I came from the New Orleans Health Department. So some of you who work regionally, I know a lot of you already. And before that, I worked for 2 different health departments in the state of Florida. So I have a master's in public health from Tulane and about 10 years of public health experience over a wide variety of topics. So right now, most of my work here in Jefferson, a lot of it is still focused on the COVID-19 pandemic, coordinating vaccination events across the parish, but also tracking our stats, making recommendations. So I'll just mention, if you haven't seen our numbers over the last week, our case count and our positivity rate has more than doubled in the past week, and this is due to the Delta variant. So if you are not yet vaccinated, I highly recommend that you get the vaccine. And we're also showing that with Delta, some people who are vaccinated are able to get asymptomatic cases and transmit the vaccine. So when you're with a lot of people, it may be a good time to start wearing masks again. So a lot of my work obviously is around COVID. I also have an expertise in public health emergency management. So I've been working really closely with the Jefferson Parish Department of Emergency Management to update some of our hurricane season plans, particularly around meeting the needs of people with special medical needs and our elderly residents. So we're doing a lot of updating on sheltering and evacuation planning. Also making sure we're able to really coordinate the healthcare system. And then on a broader scale, I am looking at how do we address public health across Jefferson Parish and what long-term needs to happen. Does Jefferson Parish need its own local health department? Does it need a bigger staff? Where are those gaps? And so to help us undertake this process, we are going to be doing what's called a community health needs assessment. And so I'm going to share just a few quick slides with you. So you know what the community health needs assessment is and what role you may play in this process. So a community health needs assessment that we typically call a CHA is required for all state and local health departments to complete every 5 years, and then all hospitals complete them every 3 years under the ACA. And so all of these groups are really looking at what are the needs of a health department or of a community, and are those needs being met? And so it's typically a 12 to 18 month process that really looks at all aspects of health and well-being, and not just your healthcare delivery, but also your social determinants of health and the equity of your systems. This information is compiled, it's put into a report, and then it's used to develop an annual community health improvement plan. So this is updated annually that really says, okay, here's our big gaps within health in our system, in our community, and here's what we're going to do about it, not just as a health department, but as a community together. Health departments are required to base their strategic plans off of the CHA chip. But it also will involve the work of all your community partners as well. So many of you I've been meeting with over the past few weeks to get to know you better, and get to know your work. And so you will also be a part of this process, because not everything needs to be done by your state or local government. And so the best practice to complete the CHA chip process is using a process called MAP, which has been developed by CDC and NACCHO, which is the National Association of City and County Health Officials. So MAP stands for Mobilizing for Action Through Planning and Partnerships. And there's about 6 steps to this process. So the first is to really get organized, develop good partnerships throughout your community. And you form a steering committee of some of those key players who will complete kind of a visioning process for the CHA as a whole. And then you will gather lots of community partners and lots of community members to complete 4 assessments. So the CHA includes kind of your vision and the 4 assessments, and ends in a report that's done every 5 years, as I mentioned. And then you take that data that you gathered in the assessment and you identify strategic issues and create goals and strategies for addressing those key issues. And that is the CHIP process, or the Community Health Improvement process. And then that document is it's a much smaller document than the CHA, and that gets updated every year so that you can track what progress you're making in those areas. So the 4 assessments that we will be working on over the next year include a local public health assessment. So this looks at the 10 essential functions of public health, who is doing each of those functions within your community, and identifying how well they are working or what gaps may exist. The next piece is looking at community themes and strengths. So this is typically done by surveying and doing focus groups of community residents to get some of their feedback about what they see in their community. Then you have a forces of change assessment, which is really looking at like kind of doing a SWOT analysis. What are our current strengths, weaknesses, what's coming up in the future that may hinder or help our progress. And then the community health status assessment. This is where you're really just getting into the data, looking at our health outcomes, but also some of the risks and behaviors that lead to those health outcomes. So these are the 4 MAP assessments that we will be conducting in order to complete our CHA. So, why am I bringing this forward to you all? One, I wanted to really take a moment to introduce myself. I know I am new to Jefferson, and this position is new. I know I've met with a lot of you, and I'm looking forward to meeting with the rest of you. But also, you are kind of some of the leaders of public health in our community, and so we're really going to need you to be a part of this process. So the next steps for completing the CHA is going to be to form a steering committee over the next month or so. Those meetings will get started, and they will help oversee what the 4 assessments look like. The state is also going through the state health assessment right now, as well as 19 of our metropolitan hospitals are also doing an assessment. And so they have created one community survey that is going to be released statewide. And so here in Jefferson Parish, we are going to really promote that survey, try and get as many residents as possible to take that survey so that we can utilize that data. And after we get those results, we'll determine if we need to if there are any gaps of where we need to focus efforts and collect more data. So that will be coming out in the next week or two, and will be open for about 2 months. And so I'll be sending that to everyone. Or Alex can help us share that, but we'd really encourage all of you to help share that with, providers, friends, family, anyone that lives or works in Jefferson Parish. And then this fall, we will actually begin our assessment meetings. And so depending on what topic we're looking at, we'll invite different people, but there will be a number of meetings that everyone will be a part of. While I am still trying to get to know everyone who's in Jefferson Parish and touches public health, and again, not necessarily directly, but if you work in housing or nutrition or transportation or some of the other community-based things that impact our health, we want those people involved too. So if you have suggestions on who should be involved in this process, organizations that I should be reaching out to, or if you just want to make sure that you are a key player in this, I'd love for you to email me. My email is sarah.babcock@jeffparish.net. And I really look forward to working with all of you in the future. Thanks. So Alex, I'll turn it back to you.
Yeah, sorry about that. Thank you so much, Sarah. I'm so happy that you were able to share all of that information with us today. I just think it's really important for our committee and our members and residents to be up to date on what's going on health-wise in the parish. So we really appreciate your time. And now I am going to hand it over to Adam, who's going to tell us a little bit more about Fitlot.
Sure. Thank you, Alex. Sarah, it's fascinating to hear about what you're working on. It's really exciting. And I personally can't wait to jump in and get involved. Really appreciate the opportunity today to share a little bit about the work that we're doing. My name is Adam Mejerson, and I'm the founder and executive director of a local nonprofit organization called Fitlot. I'm going to take this time just to share a little bit about the work we're doing nationally and locally. So we're based here in New Orleans and really dedicated to helping communities find the resources they need to plan, build, and activate outdoor fitness parks. So this actually ties very, very nicely into some of the community health needs assessment work that Sarah was just speaking to. Real quick, I just want to make sure, can you all see my screen? Hopefully you can.
We can, I think we can see it. It's showing up on my end.
Okay, great.
Thank you.
So the challenge that Fitlot is really working to address as an organization is the challenge that many Americans are facing right now and suffering from lifestyle related preventable illnesses at an alarmingly high rate. Many of us sit for the majority of our days, and we truly have to work to be physically active. We also know that many people, due to COVID-19, might still be working from home or still don't feel comfortable going back to a gym setting or even had their gym permanently closed. We know that people face barriers when it comes to regular exercise. It's really not easy for everyone. It takes time, it takes energy, it takes understanding, and it can also take equipment and sometimes be made to feel cost prohibitive to many people, especially when we're being sold kind of a constant stream of health and wellness solutions. What we do know, however, is that if we could package the benefits of regular physical activity, which is about 150 minutes of moderate activity a week, into a pill form, it would actually be considered a wonder drug. The benefits of exercise are incredible, but the realities of actually achieving an active lifestyle are really difficult for a lot of people, especially in less affluent and underserved communities. Frankly, fitness has become another indicator of socioeconomic inequality in the US. But if we can make the built environment more suitable for physical activity and simultaneously foster a culture of health and activity over time, people will become stronger and healthier, and so, excuse me, so will our communities. So this is where Fitlot comes in, and why Fitlot is working to make it as easy as possible for all New Orleanians to have walking distance access to well-designed and welcoming outdoor fitness parks. Some very quick background information is that Fitlot was founded here in New Orleans out of Propeller's Social Innovation Incubator in 2013. We originally intended to repurpose vacant lots into outdoor fitness spaces. And when we first started looking into this and designing these parks, I was working with my father, who's actually an exercise physiologist. And he was really intentional to make sure that these parks would be as useful as possible for the widest range of ages and abilities. He wanted to create a comfortably shaded space that would have a thoughtful combination of strength and cardio equipment and be laid out in a circular format so that users could really move from one station to the next to get a full body workout, and so that coaches could actually lead classes for 20 or more people really comfortably in a public setting. So early on, we noticed that just observing other outdoor fitness spaces, that people would kind of run up, maybe use a piece or two, and then seemingly not knowing how to maybe fully utilize the equipment or string together several different movements to get a full body workout would kind of just take off. So we really set a goal of making sure we did everything possible to provide park users with the tools and resources they would need to learn how to use the park. We also set out to train local fitness professionals how to be Fitlot neighborhood coaches and host community classes in these spaces. In 2017, after a few years of designing and planning and organizing, we were able to open our flagship park, which is called the What You Give Will Grow Fitlot, over on the Lafitte Greenway. It's named after our title sponsor's foundation, Thomas Morstead, who really helped champion the cause in the beginning. And for the first couple of years, we organized classes and made sure that the park was continuously activated. So I'd like to play a quick video that will just give you all a glimpse into the experience that program participants had exercising in this space and really being part of this, this group and community that was taking advantage of the classes and really trying to stay active and improve their own health. So I'm going to play this real quickly.
And you just push.
We talk about exercise, we talk about moderation and eating. When you do all those together, then we can change our lifestyle.
I like the fitness center and what it represents, being engaged and being out here, taking advantage of what's available.
A mí me gustan los ejercicios aquí por mi salud, so my health.
Start here in the air, and you just push forward.
My name is Tracey Mosley, and I'm a Fitlot neighborhood coach. I'm certified as a personal trainer, but my niche is older individuals.
You have somebody out here showing you how to use it and coaching you along the way.
These people are experts. I like them so much because they show you how to exercise and what muscles to use and why.
You know, I've always wanted to get with a trainer, so this has worked out well. I just enjoy the whole experience because I'm living what I'm preaching to other people, to exercise, get rest, and eat better.
You know, they came with a little bit of interpretation in the beginning, and now they're a family. They know each other's names.
We walked up here, we didn't know each other. We're a team now.
It's been very beneficial for me. I can write my training programs based on the equipment that's here, and you can divide it into sections. You can do heart rate, you can do strength training.
I had a stroke like 5 years ago, and my left side went out, and My left hand totally took a year to come back. Coming out here doing the range of motion exercises that we do, I think I could button my shirts better, so it has really helped me out. It's really been a positive effect on my body and stuff like that.
There's always modification. No matter what somebody else is doing, you're coming here for your own workout, and there's always qualified coaches that can help you to adjust and to do what's in your capabilities.
If you're an older adult, if you exercise and get in shape, you can actually feel 20 years younger. And it's important that our quality of life, as well as quantity of life, can be enhanced with exercise.
My mobility has improved more than 50% since I started.
This outdoor Fitlot has had me using muscles that I had not been using, so it's really, really been good.
When we first started, when we did the row machine, I only could do 20 within the 40 seconds. Now I'm up to 40.
About a month ago, I would actually have to get in a grocery store cart to do my grocery shopping. The progress I'm making really is, I can't say enough about it. It's life-changing.
Great. So I hope that gives everybody just a nice glimpse into what this space looks like and what these classes can be like, and the experience that participants can have by really getting active and being involved with a group of this nature. I've actually led dozens of these classes myself, and what has really surprised me the most are the relationships that have formed. These classes have been an amazing community development tool. This group came consistently 3 times a week for 10 weeks. They encouraged each other. They checked in with each other when someone missed a day. And even in the winter, when we didn't host classes, they continued to meet at the regular time. Like, I think we saw glimpses of a very nice community building around this space, and people truly benefiting from it. So it gives us a lot of motivation, a lot of hope. The motivation factor of fitness is also really interesting. To be successful and consistent with a fitness routine can take a lot of discipline and self-motivation, and not everyone can really just sign up for a membership and march into the gym every day. Some people need the group support or accountability of working with a group of peers and the guidance of a professional trainer. It can really go a long way. So group classes are not for everyone, but for those of you who this might resonate with, you might really enjoy this group format or even one of our group classes. We picked this location on the Lafitte Greenway because the community that it serves really suffers from some of the biggest health disparities in the country. The life expectancy in this neighborhood is about 55 years, a 20+ year difference in neighborhoods just a mile away. So we wanted to be really thoughtful and strategic with where we were investing our resources and hopefully serving a community that could really benefit from the addition of this park. In 2019, I'm just going to transition to some of the work we've been doing more recently. In 2019, we were granted an incredible opportunity to team up with AARP to help them celebrate their 60th anniversary as an organization and facilitate a 3-year legacy project for them. We received one of the largest external grants that they have ever made, and it was to go out and donate one of our Fitlot fitness parks to each state and territory in the US. So for the past 2 years, Fitlot has organized the donation of, the construction of, and programming of fitness parks in about 44 different states. And by Labor Day of this year, we'll actually have completed this initiative with one park in all 50 states, DC, Puerto Rico, and the US Virgin Islands. it's been a dream come true to work on this project, and really incredible to launch a national public health and fitness initiative from New Orleans. But my favorite part of this project is that each park actually comes with 3 years of program funds for the local Parks and Rec department to hire local fitness professionals and run about 54 classes a year for the first 3 years. I'm going to play a quick video about just about this AARP partnership, project is for the people. And it will just give you a good glimpse into actually the updated design of the park and why AARP decided to support a project like this.
This project is for the people who live, work, and play in this community.
In celebration of AARP's 60th anniversary, we plan to donate one AARP-sponsored outdoor fitness park organized by Fitlot to each state and territory that we serve.
Fitlot's a nonprofit organization that is organizing the construction of these parks. We design them, we plan them, and we build them.
The goal is simple: create a tangible local experience for our members that will last years to come.
A place I can bring the grandkids and work out all at the same time.
We're really focused on how you make a community a great place for people of all ages.
It's going to make a difference in a lot of communities, and at the end of the day, that's what matters.
Great. The one AARP-sponsored outdoor fitness park for the state of Louisiana actually was donated to Orleans Parish Parks and Rec Department, NORD, and is in Joe Brown Park. So if you ever have a chance to go over to Joe Brown, you can see one of our Fitlots over there. It's been really interesting to build parks in just a variety of different types of communities and locations, from small pocket parks to community centers, bigger sports complexes over in Arizona, and we've been able to kind of test out this model in just a variety of different scenarios and different communities, which has been really interesting for us. Now, our biggest takeaway from working on this project is that one park in each state is a really nice example, but those parks are only helping the people that live within walking distance of them. And to really make the type of community health impact that we aspire to achieve, we need to make sure that every neighborhood has access to their own outdoor fitness park. So that is why we've been organizing a plan and a vision for how to support the greater New Orleans area in building a network of Fitlots really equitably located throughout the area so that more citizens can have this type of walkable access. I'd like each of you just to take a moment real quick and just think about where the closest outdoor fitness park is to your home. Are you able to walk to it? Can you bike to it? Is there even one close by? Is the main question. Now, think of where the closest playground is. My guess is that there probably is one relatively close. Now, imagine if that playground actually had a dedicated space for the parents and grandparents to use to stay active and exercise while their kids or grandkids are using the playground. That is essentially the vision for this initiative. And we want to create more welcoming outdoor exercise spaces and are really willing to add capacity to the work the city is already doing by fundraising for these parks and essentially facilitating the process. So for the past 6 months, we've actually been working with local stakeholders like the Jefferson Parish Recreation Department and council members to identify 3 park locations in each council district that would really benefit from the addition of an outdoor fitness space. Here we have a map of these potential locations. The two red dots are Fitlot's existing parks. These three green dots are existing non-Fitlot outdoor fitness parks. And then the blue and yellow pins show the locations suggested by council members. We did the math, and currently only 2.5% of residents live within walking distance of an outdoor fitness space. And we think we know that with this approach, we could really increase the walkable access over time. Now this site selection process is really a work in progress, but we're starting to see the framework of what a network of fitness parks could really look like for the area and how much access it would create for citizens. I'm really excited to share with all of you that the first Fitlot in Jefferson Parish will actually be built this fall at the Bonneville Boat Launch. Councilmember Van Vranken has been incredibly supportive of Fitlot's GNO Network initiative and really wanted to lead by example and kick off this project in collaboration with the Jefferson Chamber Foundation to fund the first project and get it up and in use as soon as possible. So in a few minutes, Todd Murphy is actually going to speak a little bit more about this project, but we are extremely thankful for the support of Councilmember Van Vranken and the Jefferson Chamber Foundation for helping us get this started locally and really championing it. If any of you would like to learn more or read through some of the details that I shared today, you can please feel free to visit fitlot.org/netnola. And I'll even share a link to that in the chat. Okay, my contact information is also at the bottom of this page, so please feel free to reach out. I'd love to hear anyone's suggestions of other locations of Jefferson Parish Parks and Rec Department green spaces that would be appropriate for an outdoor fitness park. We are just getting started with this, so please don't hesitate to reach out. Okay, and now for just a little bit of some practical fitness advice. I'd like to just take a few minutes to talk about how all of you could actually put your closest outdoor fitness park to really good use. As a first step, if you visit fitlot.org/use, you will find instructional videos, workout guides, workout trackers, and movement charts that you can use to plan your workouts. And if you'd like to visit one of our parks but not really sure how to use the equipment, each piece of equipment actually has a scannable QR code on the instructional signs that will bring you to a video that shows you how to properly and safely perform the movement. Here is an example of the instructional video for the elliptical machine, which actually has a disc brake mechanism and adjustable resistance, which is pretty unique. I'll play that real quickly. So you can find more than 50 of these instructional videos on our website's movement library just by clicking here, and they're all actually sortable by muscle group to make it easier to pick and choose and plan workouts. If anyone on this call happens to be a certified fitness professional or has one involved in your company's workplace wellness initiative, you can actually become a Fitlot neighborhood coach by clicking this link up here, become a coach, and taking our online training program to learn how to run group classes. I welcome all of you to bring a group out to the park on your own and have a great have a group workout. It's a great tool for everyone, and it just takes a little time to get familiar with and understand, but can be a really fantastic resource. If you happen to live or work close to an outdoor fitness park, you can always plan to stop by before work, after work, or for a lunch break. A great way to warm up is to walk, run, or bike to your park. And it's really important to always come with a plan. Come prepared with what exercises you would like to do that day, how many sets, how many repetitions, and stick to the plan. It's a lot easier to just follow something that's written out than to try and think of what you want to do as you're going. I'd love to suggest people use a timer app to set work and rest intervals, like 30 seconds of work and 30 seconds of rest. We like to use an app called Seconds, or you can just Google interval timers and pull up some of the free versions online. Let's see. Okay, well, I'm happy to answer any questions, and just want to say thank you again to Jefferson Chamber and Live Well Jefferson for including Fitlot in this year's Wellness Week. I hope to see some of you out at the park. You can come and find me over on the Greenway anytime.
Thank you so much, Adam. I know that Todd is going to be joining us in a few minutes to talk about the partnership between Fitlot, the parish, and the Jefferson Chamber Foundation, which we're extremely excited to have our first Fitlot outdoor park in Jefferson Parish. And it's super exciting that it happens to be, I think, within walking distance of the chamber. So that's even better. But for now, right, I think if anyone has questions for Adam or Sarah about their presentations, let's take a little Q&A breather. And then when Todd joins us, he can talk about that partnership a little bit more. So just to review for everyone that is joining us as a participant, you're currently muted, but if you can either ask questions by typing them in the chat box, or if you raise your hand, I will unmute you, and then you can just ask your question verbally so that it's a little bit easier on you. Thanks. So for Adam, when do you anticipate classes opening? And like in Jefferson, I guess, and do you have to sign up ahead of time, or is that something you can just show up for?
Yeah, that's a good question. We are hoping and planning to build this park in the fall, and we'll be collaborating with the Jefferson Parish Parks and Rec Department on actually organizing the classes. So potentially late fall, but very likely this coming spring. And there will be a sign up and registration available probably through JPRD. So we'll probably have a mix of signups and walk-ins.
Awesome, thank you. And then here's Todd. Hi.
Sorry.
No worries, thanks for joining us.
Yeah.
Okay, so Adam actually just wrapped up talking about Fitlot as an organization, and he introduced the fact that Fitlot is coming to Jefferson Parish, and the first one will be at Bonneville. But if you just want to talk a little bit about the partnership between the foundation, the parish, and Fitlot, that'd be great. And then we can open it up to some more Q&A from participants.
Yeah, sure. Well, sorry about my technical difficulties. I was on and then kicked off and back on, but yeah, anyway, it's a great partnership. if you've been out to Bonneville, you've seen a lot of improvements out there, particularly over the last couple of years. And I think Councilwoman Jennifer Van Rankin's done a great job of working with the Bucktown Civic Association and the citizens in that area and the businesses in that area to really develop a great place. This partnership, I think, really brings something that's unique to that area. It's something that will be facilitated through our 501c3 foundation, the Jefferson Chamber Foundation. And so we'll actually be the fiduciary responsible to make this happen. And I think when it's all said and done, it'll be branded with the Jefferson Parish's new logo that was put together in unison with our young professionals. And it'll also have the Live Well logo proudly demonstrated. And more so than that too, I think bringing the element of the recreation department to actually teach the classes will be great. And look, this just plays all into what this committee is all about, what our Live Well Health and Wellness Committee has done, what our Live Well initiative has done is bringing health and wellness to the parish. So we're proud to be part of that partnership, and always proud to work with cooperative endeavor agreements with the parish, where we can do things that speak not only to improving the business climate, but as this does, improving the quality of life throughout our parish. So thanks for letting us be a part of it. And yeah, I'm happy to answer any questions or at least defer them to Adam.